Hello everybody, I am Dr. Ashish Bacchav, consultant cornea, cataract and refractive surgery practicing in Thane for the past 15 years. Today I am very proudly presenting the big announcement that Shree Mahavir Jain Hospital has initiated corneal transplant surgeries in Thane district. Now this is the only center in the entire district which is going to provide surgeries like corneal transplantation for the lesser and underprivileged section of the society. We have state-of-the-art equipment, we have experience, we have unabridged accredited facility, we have qualified surgeon. I have been practicing corneal transplant surgeries for the past 15 years. Various iterations of surgery like deep anterior lamellar keratoplasty, DSEC, DMEC, full thickness keratoplasty, therapeutic keratoplasty are all going to be performed, especially for the weaker and underprivileged sections of the society. So what is corneal transplantation? Now corneal transplantation is a surgery where the patient's diseased cornea, which can be diseased due to any reason like corneal trauma inducing a scar, or corneal dystrophies which can be congenital or acquired, or something which happened because of cataract surgery and the cornea became deranged, or anything that causes corneal diseases like keratoconus inducing scars, pellucid marginal degeneration. All these things which are not going to be treated medically is an indication for corneal transplant surgery. Now what does the patient feel when he should know that there is a problem with the cornea? So initially they will start with defective vision for distance and near. Some relative or a friend will notice some whitening of the cornea or redness of the eye. This is when they have to come and see experts like me in Shree Mahavir Jain Hospital. We will diagnose based on what we see whether it's a corneal disease and it requires corneal transplant surgery. Now there are various types of surgeries depending on at what level there is the disease in the cornea or there is a scar in the cornea, based on which we either do a partial corneal transplantation or a full thickness penetrating keratoplasty, which is a full thickness corneal transplantation. Now partial thickness is again more advanced. If it's on the anterior or the front aspect of the cornea, we do deep anterior lamellar keratoplasty, or if it's on the posterior aspect like the endothelium, we do a DSEC or a DMEC, which is the most advanced surgery. There are infections like bacterial infections or fungal infections which can cause the cornea to become diseased. There will be a lot of infections and pus on the cornea, which will also require corneal transplant surgery in the end stages, which we call as a therapeutic corneal transplant. So we are equipped to have do these surgeries, whether it is optical or therapeutic corneal transplantation surgery at Shree Mahavir Jain Eye Hospital. How do you know that you need a corneal transplant surgery? The symptoms and the signs which the patient will feel are defective vision. There will be some whitening in the cornea, or you would notice that the spectacle prescription number has gone up. This is when you should see the eye surgeon at Mahavir Jain Hospital. We will screen the patients and diagnose any corneal disorders, based on which we will put you on a waiting list for corneal transplant surgery. Once the surgeon knows that a patient is listed for surgery, we will request the eye bank to issue a donor cornea, which will then be matched with the patient. Age for age and endothelial cell count is something which we look at because it should also be a good cornea and a good match. So if the match is there, then we will request the eye bank to issue the cornea, and then we go ahead and do the corneal transplantation surgery. What to expect during surgery is very simple. You have to come a day prior for surgery. We do the basic routine investigations as we do for any routine surgery. The surgery is then done next day. It takes approximately half an hour, 45 minutes for the surgery. We will be patched, you will be given drops, antibiotics, and the next day you are going to be discharged. You will obviously start seeing better initially, but we have to keep in mind about the complications or the infections that may arise as they arise with any surgery.